So, once again, I'm visiting my favorite country. This time, interviewing aid project directors and meeting families in a western district to answer a question, because I'm worried. And in the airplane, I have time to think. Back to our year running a health clinic in Helambu, to the school children whose diet made us worry. Back to Mei telling us about his ancestors coming from Langtang and the hard life they lived, trading yak butter and the little barley they could grow for rice and fruits of the valley. And Pema telling us about his hungry childhood, herding his family's sheep for weeks at a time up near the pass, eating whatever wild fruit he could find because, as a youngest son, little food was left for him at home. You see, I grew up believing that the idyllic Himalayan villages of Pema's country represent the healthy life. And wrongly assuming that hunger is only the result of African wars and droughts. Yet, malnutrition rates in Nepal are amongst the highest in the world, on par with the African countries more often in the news. Millions of children across Nepal suffer from chronic malnutrition, as Pema did. It is a hidden killer and a tragedy for the whole country. In fact, damaging malnutrition problems are widespread in these resource-rich hills and valleys. Now I worry about many of our village friends, some still living on the mountain, and others who have moved to the city, some to India to find work. This trip is to better understand what it is like for them, living in a more urbanized, modern Nepal, and to find out what has changed this country's development approaches as it fights for the health of a new generation. Arriving in Kathmandu, the new spread of the city shocks me. And on the ground I start to hear problems. I ask, how often do you get a good meal?
Every day, maybe 1 month, time to time, I have money, I mutton, chicken.
Okay.
I have no money, I have not mutton, not chicken.
Is it difficult in Kathmandu to buy food? Enough money for food?
Yeah, difficult.
Do you know people who have no food?
Yeah, no money, no food. Yeah, here is all people no job, maybe government not pay job.
Nepal has changed so radically in the past 5 years, with immense growth of the cities and changes in information, electric and transportation infrastructures quicker than anywhere I know. It is as if one generation lived in the 18th century as children and in the 21st century as young adults. Food prices are not only the concern of my taxi driver, and leaving the village doesn't mean children now get enough to eat. At the WFP, I learn how bad the situation really is. Despite dropping poverty levels in this post-conflict phase of development, there is still
a serious problem of stunting, which is 42%, and in certain areas of the country reaches peaks of 50-60%. And unfortunately, the level of wasting are still constant, above 10% countrywide, and in certain districts above 20%.
Figures of a recent national survey show up to 5 million children in Nepal suffering from some form of malnutrition. Walking hand in hand, they would stretch from Berlin to Baghdad. They're getting too little to eat, or an overly one-sided diet. The children who eat almost only rice don't receive the needed nutrients and stay smaller, weaker, more often sick, and mentally less developed, resulting in lifelong consequences. Despite a relatively good climate, adequate soils, and relative peace, other factors are preventing good nutrition here.
We are using a very primitive kind of technology for this agricultural production. With that production, we still don't have the very effective linkage to the market. And in mostly very severe places, in those places, I think the public distribution system is also weak.
So what is being done? I learn about impressive plans and campaigns. The National Risk Reduction Consortium with its UN flagships structure, the Nepal Nutrition Group, and the government's National Multi-Sector Nutrition Plan and Scaling Up Nutrition Program with UNICEF. Engaging many government ministries together with aid organizations, placing nutrition at the center of development programs. Educating mothers is often targeted first.
One big problem that people face is the lack of knowledge, and this is why we have developed comic books like this, where information about anemia or micronutrients or food safety or balanced diet are included in an easy-to-read format for adolescent girls and children, so that they can learn about these topics.
And I hear again and again about the amazing work of community health workers, the success of iodized salt campaigns, and micronutrient powders programs, helping to bring vitamin A coverage in children and iron supplements for pregnant or lactating women to good levels. It's really a massive effort with acute malnutrition treatment centers, school lunch programs, and even model social protection schemes. And a national nutrition assessment and gap analysis documents the results, which are promising in many areas. I wonder, do people on the ground also see progress? To find out, I head straight out to Doti, a hill district in the far west. And I meet Hemnagari and his family in isolated Swati village, living with others of the Dalit or untouchable caste, surviving from basket making and a very tiny plot of barley and a few chickens. Setting up the camera brings the village around us. Here, until recently, there was no electricity, no indoor water, no phone, no doctor, no money. Limited land and large distances to market have meant vulnerability to food disruptions. The 2010 droughts hit hard and many families really suffered. I try to find out what's being done to help families like Hems escape the cycle of poverty and chronic malnutrition. One active development organization in this area is the regional NGO Community Development Forum, CDF for short. I decide to go see how they work. CDF works hand in hand with the government to reach communities across this hilly region with programs to support social, agricultural, and infrastructural development, HIV prevention and care, and women's health training, all contributing to the fight against malnutrition. I joined CDF's Dil Bahadur Singh on a visit to Daud, one of their most active program areas. We travel on the new road, the centerpiece of their rural access program. Across Nepal, road cutting is reaching the most remote communities at amazing speeds, often advancing several kilometers per year up steep mountain valleys. What do the locals think of all this digging? At the Pasner Meleg, we meet a group of women eager to talk. Dil and I stop in Rawa. where we see what new foods can be bought in this valley with its increasingly cash-centered economy. And we visit a CDF training session for new goat farmers, and we learn a key lesson.
भोगा फाले कति साल भन्नु 28 सालमा है 28 सालमा डन्जुरामा हैन हैन सिलगढी एयरपोर्टमा भोगा फाल्यो त्यो प्लेनले भोगा फाल्यो त्यो मकै तराई गएका 5 हामीलाई बर्खातिर अलि समस्या हुन्छ अस्ति होला गाडी कन्टिन्यू हुँदैन त्यो भएर अलि समस्या हो त्यो सच्ची कुरा त हो तर कुरा मान्छेहरुको बचत गर्ने पनि विकास छ
For lunch at the tea house, I tried the local bread made from finger millet. This is kodo roti.
Yeah.
And it has high iron content.
Yeah.
And now we're eating dal bhat. I know in other parts of the country, the change in diet preference from local iron-rich rough grains, that's millet, barley, and buckwheat, over to white rice has been blamed for both harming the local farming economies and for reducing the nutritional value of the food eaten in each home. But time is short and I don't get to ask about that here. There's Dill. Dill and I are going to now go up this way. About 4 hours to the next village, hopefully before dark. At the next village, we hear stories about other infrastructure improvements. Most notably a micro-hydroelectric generator powering several villages and enabling quick, affordable grain milling, which together with the new road, brings the first profitable export of staples for cash.
हामी भारी बोगीबाट दिवाइलोको भारी बोक्दालाई हामीलाई कति तकलिफ थियो स्थितिको बारेमा धेरै नाजुक थियो पहिला यो रोड आयो हाम्रो यति जमिन गयो भनेर हामी धेरै पछुताएका थियौं अहिले रोड कहिले सञ्चालन होला कहिले होला भनेर सबै जनताहरुबाट अलि हामीले बढी नसके पनि हल्का प्रयास गरेका छौं पहिलाको भन्दा हामी तरकारी खानलाई कोदाको रोटोमा नुन पिसेर खान्थ्यौं.
Yet, despite the direct economic benefits and the obvious ecological impacts, the new road connectivity has some other, and to me unexpected, effects. Combined with overpopulation, land degradation, and caste-based land ownership problems, the new need for cash drives men to migrate seasonally for work.
Like 60 or 70% of the young male partners, like they are all out of the country to Middle East or some other labor work. So that has a little bit of influence on this bringing child to the health center, woman taking more workload.
Yeah.
Hilly regions not not supported the crops. Hilly regions, some people are go to the India to earn some money. That is the main occupation, not to the cultivation of this area.
I imagine they must bring back a lot of money from these jobs.
Most percentage of this money are used for their own consumption rather than, it doesn't give their, productive kind of accumulation of their agricultural land. So it's not just because people are coming to the Kathmandu and leaving their land fallow, but it's also the issue that people, they do not care because they will have some money and they don't have enough skill, capacity, and the realization of this. They can actually be using that, the productive resources.
System of producing food locally and consuming it is being lost. I'd say so. That is going to be a very big problem. Agricultural system is kind of collapsing in the village areas.
The young men from Dowd certainly fit this pattern, and I imagine the resilience of the residents of Doti are tightly interwoven with the decisions of these youth. Did you go also in Gulf?
Yeah, Gulf.
You went to the Gulf?
Gulf, Qatar country.
Yeah?
Yeah.
What did you do?
Labor. Very hard job, labor.
Yeah. And you came home here with money or no money?
No money. I have problem. I have big problem. I have appendix operation and come back. 2 years, 3 years. My wife go my home. My son maybe 3 years. And maybe try next one time outside.
At the edge of Ptolemy village, I meet Ram. He's 17, and as landless untouchables, he and his mother and siblings live in this roofless house. They're dependent on the small jobs they can find in the community to pay for food. He is the only one of the 6 capable of traveling for work, and with Doti's improved road network, he can be in New Delhi, India in a matter of 2 or 3 days, where he earns 4,000 rupees, or about 50 euros per month, as a sweeper. But as with many migrant workers, when he returns home, even if he is able to bring money, he is stigmatized, suspected of bringing diseases. HIV is indeed on the rise here.
Third is also HIV infected. That's a big issue for Western Nepal. They are poor, so they go to India. So there's a big issue also challenging.
CDF is active protecting migrant workers by running HIV education centers at the local bus stands. Dill explains that HIV is a major factor in family malnutrition rates here. I hadn't known that before. Also, I hear how migrants are trained in how to bring their money home safely via banks or mobile money transfer systems to avoid theft. On the path back towards Silguri, Doti's capital, we begin to notice how widespread the mobile phone use has become and how it has allowed salaries to be paid right in the village. And the government is gearing up mobile programs too for delivering health and nutrition counseling where community health workers cannot easily travel. Back in Kathmandu, I visit Paraki, a slum along the filthy Bagmati River where many poor migrant workers land. I suspected I would find big gaps in food access here, yet meat and vegetables and eggs seem to be in every kitchen. I thought that the focus of aid programs primarily on rural poverty would leave the megacity in a bad way with its disastrous village-level infrastructure and astonishing immigration rate. Yet Kathmandu, like a sponge, has a magical way of absorbing millions of people into existing housing. And even in the few small slums that do exist, the cultural dignity of the Nepalese shines brighter than any concerns for hunger. Somehow they find a way in this cash economy to earn, to buy food. For now, so long as the global market prices of wheat and rice stay low, the city dwellers seem okay, and the bigger NGOs are worrying more about preparations for the next big earthquake, whose consequences I would not like to ponder. While it is the lower castes, the landless, and the HIV infected who are most food insecure in the villages, in the city, resilience may be based on other factors entirely. Across Nepal, the people I meet describe a commitment to education and a wish to enter the modern economic world with a focus on purchasing power and market access over self-sufficiency. All in all, the interviews are inspiring and hopeful, much different from the fearful atmosphere of 5 years earlier. Despite challenges, I hear about huge improvements in food availability, and most people thanking the new roads, electricity, and even mobile phones for the lifestyle changes they have wanted. I see big changes in diets, not always in line with the public's rapidly improving knowledge of nutrition. Obesity is already knocking at the door in Kathmandu. For Nepal, there is no looking back. In many places, subsistence farming is very rapidly disappearing. In some places, it's replaced with commercial agriculture. In other places, empty villages. So what comes next? How can the guesswork be taken out of designing the next development and nutritional programs for Nepal? Thanks to the Health Ministry and many aid agencies, an excellent national monitoring system is in use. It will help, together with careful analysis of the best evidence. But I fear that the societal changes are too quick. Only time will tell for sure what time will bring. In a way, my trip raised more questions than I answered. What's the biggest enemy to fight? Is it white rice? Or in-family food distribution hierarchies? And food avoidance by pregnant women? And what about culturally driven changes in the self-perception of food insecurity? Which nutrition indicators matter to families of migrant workers? And what about crop insurance for small farmers? Three days before flying home, I make a final trip up a new road to our old village and find that virtually everyone is gone, leaving only 4 people and a dog to tend to 27 houses. The rest have emigrated for work to India, Saudi Arabia, Malaysia, Japan. 40,000 people leave Nepal per month. What role will the remittances sent home by these new emigrants, and 15 million already in the Nepali diaspora, what role will it play in reducing malnutrition in Nepal? I do wonder. Then Dorje shows me something new, a toilet. The regional government required all families to build one this year. Thinking back to the diarrheal diseases and flies of the village in the past, I realize this may be the most important nutritional intervention I've seen in my whole trip. Now the trip is over. I thought I would be researching urban feeding centers or nutrient supplementation powders, but the main messages I've heard are all about infrastructure making jobs possible, both in the village and the city. And in a modern world, jobs are what make good nutrition possible. That's the bottom line I hear again and again here in Nepal. On my way home through the airport in Frankfurt, something in me has changed. I can't hold steady as I look at the bakery food. I don't know which world is mine.